Hi, everyone. Again, I lost a little bit of time, 15 seconds, but I'm going to do a quick run of my very dry January, specifically focusing on oncology treatment guidelines. So, no surprise, you all know that treatment guidelines are complex. With cancer, we're looking at even more complex decision trees, right? So all of these guidelines look like a decision tree with a lot of notes that would help identify a treatment. This is just an example of a first-line treatment of metastatic bladder cancer. So upon diagnosis, there are certain decisions to be made until a treatment is recommended. So if you take a look, you have to, if you have this, after going that theoretically at each node, you have to answer this, go to the next one until you have a series of treatment recommendation. If you look at it, theoretically, you can ask a lot of questions from the guidelines. To what degree are these recommendations applied in practice? Are they relevant? Do we have a specific significant number of patients in the real world to start asking these questions for each of these scenarios? Are these generalizable? Do we see effectiveness and similar safety profile as we expect based on what we know from the guidelines? And are there other notes that needs to be included that we don't know about or unmet needs? But if you go back, each of these decision points are constituted of a series of criteria to be able to answer these questions. So a lot tumor specific, disease specific, and the general health state specific. Important question that obviously all of us should ask ourselves is that, do we even have the data to ask these questions? So not going to go through that, that's long, but some of them we widely have information across the network, some if we get lucky, and some probably not. And even if we have them all, if you look at the guidelines, at the end of the day, a lot of the decision is made by the practitioner. So the guidelines at the end do not really tell you this is where get treatment 1 or 2. That's an opportunity to ask questions. Go to the second line, it's a little bit even worse than the first line. A lot happening. There are still decisions to be made or not. You can make a decision whether a patient was treated or not, whether they're in first line, whether they're cisplatin eligible. And then even after that, you see that these decisions pretty much don't have any consequence. Can pretty much give erdafitinib irrespective of whether a patient was cisplatin eligible or not in the second line, or have been exposed to first-line checkpoint inhibitor. So now what? Again, this shows that there's lack of evidence. But assuming that I have the data, we can start asking questions for each of these nodes. The one important question is that can we actually study something that and generate evidence that is clinically relevant? Remember, we're assessing guidelines. We want to generate evidence that feeds into the guidelines, be used at the practice by clinicians. So are we picking the right one? This is something that has to come from the practitioners, from the clinical community, and from the authors of the guidelines. So what are we going to do? With this one, we decided to do a little bit of a different approach. Instead of picking up or coming up with one note, we're going to assess the guidelines systematically. Here, as a proof of concept, we're going to pick up the metastatic bladder cancer guideline, EAU, parse all the notes, assess the availability of the data within the Odyssey network with the evidence network, and then engage with the EAU guideline office. We've already contacted them. They're very eager to be a part of this activity to help us understand the guideline gaps, the current gaps, and help us establish an approach that can be used as a process for any real-world evidence incorporation into their guidelines. Once we identified the nodes, we can, and also the evidence gap, we can pretty much say what is it that we can answer with good power, with right data, and run that study, generate the evidence, and feed it into guidelines.